Okay, and we are live. Hi, I'm Philip Lee. I am with the Sioux County Community College Marketing and Public Relations Office. And this morning I am with the Sioux County Community College Respiratory Therapy Program with instructors Janae, Zachary, and Arlette Austin. How are you today, ladies?
Doing good.
Good.
And great. And today we're going to talk about the respiratory therapy program, obviously, and we're going to be talking about enrollment in the spring 2021 semester. You have some spots available today. And so let's go ahead and talk about it. Why should people want to enroll in this program?
So as he said, we do still have some spots available in the program. We have 5 left. We can take up to 18 students, which means we already have 13 admitted for the class that starts in the spring. The reason that we start in the spring, it's a little different than most programs because we do require you to have some of the general education courses done before you come to us. We used to have them all together, so we used to start in the fall, and students just found it too hard to try to get some of those general education courses done at the same time as our core curriculum for respiratory therapy. So then we just split those, and so now we require you to do most of those prior to coming to us, which is why we don't start until January. So we give you that fall semester to get some of those done. As far as why you should want to be a respiratory therapist, well, I think the COVID-19 pandemic has kind of illuminated why we need respiratory therapists, especially with dealing with any kind of respiratory illness or disease. As far as what you learn in the program, we're going to teach you how to assess a patient, provide therapies to a patient. You're in on the emergency response team, and in some cases with our critically ill patients, you're even going to breathe for patients with a machine. So those are the basic skills we're going to teach you while you're in our program. As far as everybody kind of always wants to know, okay, how much money am I going to spend to do this? And then what am I going to make once I get done with the program? So you're going to spend around $13,000. That's with your courses for general education courses, and then all of the books and courses that you're going to take while you're in the program, including your exam review programs will help you get your ACLS certification. And that's just like the advanced cardiac life support certification. It's a little bit heightened from CPR. You'll also be required to get CPR while you're in the program. So you'll spend around $13,000, and then you'll start out making anywhere from $45,000 to $60,000, and that really just kind of depends on where you go. Some of the bigger hospitals, of course, because you're doing more intense therapy and you're taking care of more patients, will pay you more. And then you can just kind of work your way up the career ladder. You can always work extra days. You only work 3 12-hour shifts. That's full time for pretty much any allied health career. And then you can always work extra days at other hospitals. You can pick up days at your hospital. So really how much you want to make is up to you. And then as far as getting extra certifications, you can keep learning and keep working. And of course, the more certifications you get, the more you'll get paid as well. Trying to think what else wanted to tell you about the program. We do clinicals pretty much all over in Southwest Kansas area. It's a little bit different than maybe like the nursing program because there's less RTs on staff at one hospital at a time than say like nursing. So we have to use multiple sites so that each of you get a good clinical experience and get to work with one preceptor one-to-one. So we use about 13 different sites in Southwest Kansas, all the way up to Hayes, Pratt, Wichita. We even go to Amarillo. And then the final critical care rotations, those are in Lubbock, Texas, Oklahoma City, Oklahoma, or Wichita is a new one that we started adding for that last summer critical care rotation. And that really just gets you exposed to using those mechanical ventilators and really dealing with those critically ill patients that you may not get to see as much in our smaller hospitals around here. And that's vital to you coming out as a competent respiratory therapist out of this program, being able to go work anywhere in the US. So
What would you say is the success rate or the job rate of people getting jobs when they come out of this program?
I believe our threshold is around 92%. So most of the time, unless a person just doesn't want to pursue a career in respiratory therapy, there's always jobs available. The other part of having all of those clinical sites is that every time you go to these clinical sites as a student, they're looking at you as a prospect for wanting to hire you. There's always jobs available, especially in the bigger hospitals. Of course, if you're willing to relocate, there's more jobs available because they have more RTs on staff. And so, yeah, whenever you go to the clinical sites as a student, they're looking at you as a prospective person to hire. And so you get plenty of opportunity to find a place or a person that will try to recruit you.
I think it's probably fair to say too that Seward has had pretty good success rate with the hospitals over there. I would imagine that they're all they're pretty happy with the students that they're getting and hiring.
That's actually one of the things that we do have to report. So after our graduates go out and work for a while, we do have to get back with their employers within the year. And then we ask them about their satisfaction with our graduates, and we've always had 100% satisfaction. And that's on a Likert scale of 1 to 5. As long as they are at least average or higher, then that's considered success or satisfaction.
So for the most part, you know, it's basically what the students put into it. If the students put in the effort and time, they're going to do well.
Right. We try to give them as much clinical experience as we possibly can. We start that even the first semester. First part of the semester of the first semester, we actually take them into the lab, and that's where I kind of teach them how to assess a patient and do some of our most simple therapies. But as soon as we get them through that, we start getting them in those clinicals, because that's really feeding the complementing our lecture part, so that they can actually do hands-on other than just in the lab where you have a mannequin. Now you're actually working with a real person and providing care. So that's really important to their learning.
Yeah. And Arlette, you know, this is one of the great things out over here is that you're a former student and you've gotten a job and you've worked in the field, and now you've sort of come back full circle to sort of give back. Tell us a little bit about yourself. Tell a little bit about your part at in the program.
So I am the director of clinical education for the program. So I'm the one that's in charge of making sure that all the students are, you know, following the guidelines for every clinical site. The spokesman really between and the messenger between the program and the hospital. So a lot of communication there. Just a little bit about myself. I'm actually a Liberal lifetime resident. I was raised here. I graduated from Liberal High School, and I also graduated from Seward County Community College, and specifically out of the respiratory therapy program here. And then what happened there is I went ahead and went on to work in the field, and I was doing that for a while. And then I wanted to pursue my bachelor's degree, especially after this position came up and I was offered potentially to take this position. So what's great about it is that Seward County Community College and specifically the RT program here, there's a consortium agreement between us that when you graduate here, it is very easy to transition onto KU and finish up your bachelor's degree there. I was actually able to finish within 3 semesters. So a little bit, roughly over a year, and I was completely done and onto my bachelor's degree, just because I took all my prereqs here. I took obviously the core RT courses here, and then I went on to pursue my bachelor's. So if you are interested to go on beyond just an associate's degree, this is a great program, and we will work with you along with KU. We work together to help you achieve that goal, to obtain not just your associates, but your bachelor's, because we also have an agreement with them that if you're a student within our program here, you can actually start taking some of those core classes for them up there at the same time. And then even, you know, within even less than a year, really, you could probably be able to achieve that bachelor's degree through them. Another thing, too, that I would like to add is, of course, I was a first-generation college student years ago, and if you are unsure and you're not certain how to obtain a college education or how it even works to get started, I know the feeling, and I know how that, you know, I'm here to help, and I'll be more than happy to help you reach your goals and dreams. So just reach out to either Janae and I, and we will be more than happy to work with you and help you be successful and become a respiratory therapist and just be successful from now on and the rest of your life. So, and again, Seward County Community College is a great place to receive your college education, just for the fact that the staff here and the instructors are always committed to student success. So
Yeah, I think that it can't be overstated that, the relationships are just so important. And especially with you, Arlette, you've gone through this first generation, like you said, going through this and understanding the other students who come in over there and building a bond and saying, hey, well, this is kind of tough and this is pretty hard to have to go through this, but yet as a former student, as someone who's gone through this, you sort of really understand how it goes. And I'm sure that your relationship or your experiences can be passed on not only to Janae, but for the whole entire allied health department over there, understanding where people go and says, well, maybe this person's struggling a little bit. Well, why? Well, I got it. I understand. And I think that's really important. And I think one can't, like I said, can't stress that enough is that when people come to you, it's like, well, yeah, I understand. And I think that's the one thing great about, community colleges in general, is that you have really that bonding relationships that you may not have, even though that you want to go on to a great big school like KU and further your career. Sometimes a lot of the building formations start at the community college level. And when we have instructors who have gone through the system and are benefiting from it, I don't think that there's can be much more said that that's great.
I definitely agree with that too. I started out, I went to Fort Hays State University, and it's real easy at a university to get lost, because you're kind of just one in a whole bunch of students. And I kind of wish I would have went to a community college first, just because of the community atmosphere that you feel here. And if you don't come to class, instructors hunt you down and ask what's going on, and people notice if your grades are slipping. And because we are kind of a tight community, we all can communicate easier with each other and let each other know what's going on, or if we have concerns about somebody, and really get to know our students on I think a higher level. So I can definitely attest to that too. I wish I would have done it in that order. I think I would have had a more successful first part of my college experience, but yeah, I agree. I think it's a good place to start for everybody.
Yeah. So Arlette, have you gone through that already? And like, you've been here for, is this your second year now?
Actually, I'm going into my third.
Okay, so this is your third year. So during your 3 years here, so I'm coming into your third year here, have you run to those students over there? Have you built those relationships? Have you sort of gotten a feel for some of the students who have gone through the same thing that you have?
Oh, most definitely. I've had a lot of students reach out and they say that they appreciate the understanding that I portray, because the simple fact that a lot of them are in the same boat I was, over 13 years ago. So, and I, in a way, and a lot of staff here back then helped me, and I felt that compassion too when I was a student. So I feel like it's only fair to portray that and give that back to the community. So it's actually a really gratifying feeling to see a lot of the students that are, again, first generation, that are making a big difference in their family. And a lot of them feel like they owe it to their parents. And I felt the same way, just for the simple fact, because again, many come here from a different country, and a lot of the parents, that's what the reason why they do so, is for their children to have a better and more brighter future than in their home country. So I can definitely relate to a lot of students that are at that level too.
One thing great about this is that it doesn't necessarily, while you can go out and be in the field itself, you guys can come back and actually, teach about your trade. And I think that that's just great too. I mean, so it's not just about going out in the field. There are other things that you can do with your degree and the field that you go into.
Yeah, I mean, the teaching was just one option. I think that's why we kind of push the bachelor's degree, especially if they have any want to do management. You can always manage a respiratory therapy department. You could move up within the administration at the hospital eventually, but a lot of times they are going to want you to have those higher degrees. So if anybody is interested in doing something like that, we do kind of push them to keep continuing on, because once you stop school, it's really hard to make yourself go back. Life happens. So if anybody has any want like that, or to even teach someday, if they want to continue on with their career and keep trying to excel higher, then we do try to push them on to get a higher degree. Some people just want to be a respiratory therapist and just get through the program and go out in their field and work, and that's fine too. But that doesn't mean you can't go back later on to school, but we always kind of encourage them, if they do want to go on now before life happens and then you can't afford it or you don't have the time, that kind of thing. So, and you can do that all online. We also have other agreements. We have an agreement with, I think, Fort Hays State, Northwestern University, which is out of Texas, because we used to have some students that got recruited to work down in Lubbock, Texas, and then they were residents there. So then we have a university down in Texas for those students, so they're not having to pay out of state tuition once they move there. And then we also have Ottawa. And most of those other three, they don't actually have a respiratory therapy degree for a bachelor's degree, but they do have, it's more like healthcare administration type of thing. And they'll teach you more about budgeting and leadership and some of those other qualities that you may not get just in the respiratory therapy profession or core curriculum.
Let's talk a little bit about this past year, the pandemic, and how that has sort of affected teaching over there. What can students now sort of expect? How have things actually, let's start from the beginning. How have things gone this semester with the pandemic? Have things have to change? Have you had to go to remote learning, more face-to-face? How's that all sort of panned out for you guys?
Arlette, do you want to talk about it or you want me to?
I can too. So as we had stated earlier in the semester, Janae and I reached out and helped Southwest Medical Center for a while during the spring and on to the summer. And then when we started classes here, so far, everything's going well. We're still on campus. We're still face-to-face, and I couldn't be more grateful for that. I know we're at this point going through a big surge, the whole state, I should say, or country at this point. So again, we should just really continue to be precautious, social distancing, hand washing, and just really take care of ourselves and those around us. This is the only way we can battle against this and hopefully keep campus open as long as we can throughout the whole academic year.
Go ahead, Janae.
I was just going to follow that up. The only thing I was going to say is just in March, we did go virtually, but Arlette and I and most of our other allied health programs were already pretty set up for that. Because we do have distance learning opportunities through Garden City Community College, and now we're offering it at Dodge City Community College as well to attend our lectures and be in our program on their campus. We were already using Zoom, so our students were kind of accustomed to seeing the Zoom being used in our classes, and they knew how to watch our virtual lectures because we always record them and put them out there on our Canvas, which is our online platform for our students, for our courses. And so they kind of were already aware. They definitely prefer face-to-face because some of our classes are 4 hours long. So when you're at home, it's tough to really stay focused when you got your kids and you got everything else going on because, of course, nobody was watching kids either during the spring. So there's too much distraction, I think, at home for a lot of the students is what they say. So we've definitely loved having them back on campus and face-to-face this semester. Like Arlette said, it's been great so far and everybody's been doing their part. So that's been great.
Everyone basically taking precautions, being safe, and just so I think that one of the things is that's a great thing, and a lot of people questions like, how can you be a respiratory therapist if you're not going and actually doing hands-on work? And I think that there's a lot to be said about that because that's what a respiratory is actually being hands-on.
Right.
So I think that's probably for you guys a little bit of a balancing act, huh?
I think that even just like what you were saying, I think, we did lose some students from first semester to second semester because they never really got to have that hands-on experience for the clinical sites because they were closed down. So it just kind of shows how important that aspect is to their learning. And just like you said, touching and feeling and being around patients really gives you that reassurance, hey, this is really what I want to do. And I really like this. So it just kind of shows how important that aspect is. And we are back in all of the hospitals starting in this fall. So it's been great. And all of our sites have been really great to help protect our students.
Yeah,
what would you tell some potential students? I'm sorry, when you say something?
And just to add what Janae was saying, a lot of feedback we've been getting from the current students we have now, and even the ones that are already accepted into the program for this next cohort, they've actually had said that more than anything and more than ever, they really truly want to do this because being in a hospital setting and seeing what the other respiratory therapists do on a daily basis and how they're battling against this pandemic has really reassured to them that this is really what they want to do. You know, they want to be and they want to help in the future and be part of those heroes.
Yeah, I think that's really important, and especially for you guys too. And Arlette had touched on it, is that, you know, you guys went in, became instructors, but over the summer, when they needed you at Southwest Medical Center, you guys went back. You guys actually, took the call to, to help the people who were in the pandemic at the hospital. And you wouldn't have done that unless you really cared, unless it was in your blood, unless you really wanted to do it. And I think that sort of says a lot about anyone, hopefully, as they go through this program, is that, it's a job, true, and you have to earn the money somehow. But the whole thing here is that you're doing it and you love what you're doing. You want to help. That's why we get into these, the professions that we want to do, right?
Right.
Yeah, that's the number one thing. Any profession here at Idolize Health, any healthcare professional will say, in order to be in healthcare, you have to have an immense care for others and just a really big heart.
Okay. Anything, guys, you want to add for your potential students?
Just that if you're interested at all in respiratory therapy, come talk to me and Arlette. We would be happy to help make a degree plan for you. If you have your prerequisites done that we require, we'd love to help you get an application, get it filled out and get it turned in, and hopefully get you admitted before January starts. We would love to have anybody that's interested at all come see us.
Is there a deadline?
There's not necessarily a deadline. I mean, we start in January, so you'd have to be admitted before the January start of the class, but usually we just keep admitting until we're full, and we still have those 5 spots available. So we'll admit up to the day before classes start. So.
And who can they contact and info for them to get the application started?
So you can contact me, Janae Zachary, I'm the program director, or you can contact Arlette, who is our director of clinical education. Either one of us, just depending on our little door schedules, it'll tell you if we're in instructing. Most of the other times we're here in our office. You can stop by the Colvin Family Center for Allied Health. Whoever the secretary, or right now, whoever's covering for that person, can help direct you to the right place. They can get you an application. We can get you set up as far as that. You can also contact me on my phone, 620-417-1410. And then my email is just first name dot last name. So Janae.Zachary@SCCC.edu.
Anything else you want to add, Arlette?
No, just my contact information is 620-417-1406, and then email first name, last name, arlette.austin@sccc.edu. And again, we'll be more than happy to guide you and help you and achieve your dreams.
All right, guys, we really appreciate the time. And I know that this semester has been an interesting one, and I'm sure that next one will be just as good. Hopefully things will get better, and you'll get your students.
Yes, I agree. We're just hoping that we're all going to get to stay face-to-face. So everybody over the holidays, be safe, be careful, try not to travel too much if you can, and have fun with your families though too. So.
All right. Okay, guys, thank you so much. Have a great day.
Okay, thank you. Bye.